between the brain and the body is probably an artificial distinction. So Descartes, the mathematician, said, "I think, therefore I am." And this was the beginning of what we call the Cartesian split, separating the brain from the body. And now, this distinction between the brain and the body is probably a fairly Western European thing. In some cultures, there's a much stronger sense that the brain and body are connected. And so bringing those two things together is so important. And it's important for two reasons. One is that we're not walking around brain in a vat or a body without a brain. Everything is connected. If you have asthma, if you have eczema, you know that if you're experiencing stress, those conditions might get worse. So for people to understand themselves, for doctors and other clinicians to understand patients, we need to put the brain and the body together. Prevailing psychological theories suggest that mental health difficulties are a consequence of your early life experiences, about your attachment styles. That's how you relate to people, how you were related to when you were younger, and also some chemical imbalances in the brain. You know, we think about the serotonin theory of depression. People talk about dopamine with ADHD. But what my question is, who is particularly susceptible to these problems? And what I think and what the research that we've been doing over the years suggests is that it is people with this common variant of connective tissue being the cling film that's throughout the body, that is stretchier than it should be and results in flexible joints, that people with this particular body type seem to be more likely to experience mental and physical health problems. So they are overrepresented in groups with anxiety, in groups with ADHD, in groups, autistic groups, but they are also overrepresented in asthma, in inflammatory bowel disease, in irritable bowel syndrome, in a condition where you feel dizzy when you stand up called postural tachycardia syndrome. There seems to be a link with allergies. Basically, every system of the body, and the brain is part of the body, seems to be affected by this difference in connective tissue. As an adult psychiatrist working in a neurodevelopmental service, I see far more female or non-binary patients than I see male patients. Many of them, even if they're in their early 20s, have a very complex psychiatric history, have been known to CAMHS. They have a history suggestive of dyslexia, dyspraxia or dyscalculia, so difficulties learning to tie their shoelaces, learning to hold a knife and fork, and they have so many diagnoses, like almost all of them, that we could think of. Many of them have body-focused repetitive behaviours, and what interests me as a liaison psychiatrist is they often have a very complex physical health history that many feel has not been well understood. But the big idea is that we should drop the distinction between mental and physical health. And I think that that is so important because by existing in silos, we don't necessarily join all the dots together and our patients don't get the service and treatment they deserve. So people who are wondering whether they're hypermobile, there are a couple of things that they should do, and then that will hopefully give them information in order to go and talk to their doctor or their physiotherapist or their clinician. There is a self-report questionnaire, and if you score 2 or more out of these 5 questions, it is highly likely that you have hypermobility. But they are things like, can you now or could you ever bend your thumb back to touch your forearm? Can you now or could you ever put your hands flat on the floor without bending your knees? As a child or a teenager, did you amuse your friends by bending yourself into strange shapes, do contortions like the splits, party tricks? When you were a teenager, did your shoulder or kneecap dislocate on more than one occasion? Dislocations are a feature of some symptomatic hypermobility. And finally, do you consider yourself double jointed? Now, if you answer 2 or more out of those 5 questions, there is a very high chance that you have something called generalized joint hypermobility. And if you then have symptoms, you may have hypermobility spectrum disorder or hypermobile Ehlers-Danlos syndrome, or possibly one of the rarer Ehlers-Danlos syndromes. Hypermobility, of course, can be advantageous. So people like Simone Biles, Michael Phelps, they are hypermobile. Incidentally, they also both have ADHD. But hypermobility is linked to a variety of medical issues, and these cross systems and involve both the body and the brain. And I think, as someone who has a PhD in hypermobility, that actually the classification and screening tools, the different words to describe hypermobility, like Baton, Brighton, JHS, HSD, HEDS, are actually really confusing, and they make the picture more complicated. So this is it, alphabet soup. So the real thing is, does the person have hypermobility and have no problems, or does the person have hypermobility and have problems? If they have problems, then they have either hypermobility spectrum disorder or hypermobile EDS. If they don't, they just have hypermobility. There is a really good resource. I've talked about the Ehlers-Danlos syndromes. Well, the EDS UK, a charity for hypermobile people, they have a resource called the EDS GP Toolkit. Now, if you go onto the EDS GP Toolkit, just Google EDS GP Toolkit. It's also one of the papers at the very top of my link tree in resources. It will explain this to your doctor. It will describe the common other problems that you might have, so things like recurrent ankle sprains, easy bruising, varicose veins, and it will help your doctor manage some of the common problems associated with symptomatic hypermobility. So it seems bizarre, the idea that people who have flexible joints, who maybe did party tricks when they were younger, maybe their thumbs bend back strangely, that they may actually struggle with social situations or with focusing, and you think, how can that be connected? But we know from work that we have done at Brighton and Sussex Medical School that there is a relationship between hypermobility and conditions like ADHD and autism. We also know that people with neurodevelopmental conditions are far more likely to have certain physical health issues and certain mental health issues. So, this is a big cohort study, the whole population of Sweden's registry, that showed if you had a hypermobility diagnosis, you were 7 times more likely to have an autism diagnosis, 5 times more likely to have an ADHD diagnosis, 3 times more likely to have a bipolar disorder diagnosis, and unfortunately twice as likely to have attempted suicide. So this is the tip of the iceberg, because hypermobility is rarely diagnosed, as is ADHD and autism. Anyway, we did a study published in 2022 where we showed locally in 110 patients that our neurodevelopmental condition patients were 4 times more likely to be hypermobile, and that they had more symptoms of orthostatic intolerance and pain, and that hypermobility explained this link between neurodevelopmental conditions and physical health problems. Now this graph, I want you to look at the pink bits. So those are our patients, female patients. Do you see how 75% of our female ADHD and autism patients are hypermobile? I mean, this is huge. This is like the panic disorder having 70% being hypermobile. In fact, almost any study of hypermobility in another condition that we have done, whether it's published or not, in that condition, it seems to suggest about 70 or 80% are hypermobile, and that in the general population, less than 20% are. I mean, it's a very clear signal. So if you are hypermobile, and we know this from data from Sweden, you are 7 times more likely to be autistic. If you're autistic, you'll have differences in your social communication, which means you could have relationship difficulties. You're 5 times more likely to have ADHD. If you have ADHD, you may have difficulties with impulsivity, with emotion regulation. This means that you could perhaps have difficulty with relationships. It means that you could also potentially have difficulties at work with focusing and things like that. But it also means that you may be more likely to think outside the box, and that sort of impulsivity of fidgeting and of thought may in fact make you quite a unique person. I think that this brain-body type is both a positive and a negative. So some people, especially in the neurodiversity world, they talk about autism or ADHD as a superpower. And other people in the autism and ADHD world talk about a tragedy, about it having ruined their potential and having stripped them of possibilities. And I think that is quite a black and white way of looking at the world. And really, for any one person, there are strengths and challenges associated with this brain-body type. But there are people who would say if you put labels on people, that you're just going to make them feel like they can't achieve, that they can't do the things they want to do, that it becomes an excuse for doing nothing. I don't think that's true at all. By helping someone find the right label, now the right label is absolutely key, it can unlock the key to self-understanding. And it can suddenly make sense of all of the seemingly bizarre things in your life, and they all come together. So you might think to yourself, why is it that I am always spraining my ankles and I can't work out whether to push or pull a door? Well, that might actually be because you're hypermobile and neurodivergent. And instead of thinking, oh, I've got 6 separate problems, irritable bowel syndrome, anxiety, anger management issues, depression, autism, ADHD, in fact, I am a whole textbook. Maybe it's actually much more simple. Maybe you have variant connective tissue and you are hypermobile and you have one thing that is manifesting in all of these different ways. Tune in next week to hear me talking to Jane Green, who is hypermobile and neurodivergent herself and has set up the world's first organisation and charity specifically designed to support hypermobile neurodivergent people. See you then.